talked about that. Of course, I shared my vaccine experience here on the channel because I think it's important. And this isn't, I don't know what crazy excuse the right wing would make. You just love pharmaceutical companies. Oh, the left just loves pharmaceutical companies. You can't hear them. You can hear them always talking that way. How much they love Pfizer and Moderna and all that stuff. But really, no. I mean, the government gave tons of money to these companies. One thing I think that's a little nice to point at from the vaccine is look at how everybody gets the vaccine for free, right? If you want the vaccine, you can go get it. It's totally free. It's basically Medicare for all in this one limited case, which is the vaccine. And why is that? Because the powers that be want us all to get back to work. Get back to work, peasants, right? And produce, right? Get out there and consume and produce and, keep this whole game going, as it were. But the vaccine is very important, I believe, out of just basic public safety. If you care about people and you care about the people who've been affected by the virus, you should care about the vaccine rates, where they're dipping, where they're proving a problem. So right now in LA, if not far from me here, I'm on the Central Coast of California. In LA, we have the Delta variant is just spreading throughout Los Angeles, California, and other areas. And this is just a much more contagious and in some cases harmful version of the virus. And it's on the rise in LA. And so vaccines are definitely being pushed and urged here. Listen to this in the LA Times. Confirmed cases of the highly contagious Delta variant of the coronavirus are on the rise in Los Angeles County, prompting renewed calls for residents to take advantage of the available vaccines. While COVID-19 case, hospitalization, and death rates remain low county-wide, this particular variant, which could be 2 times as transmissible as the conventional strain, COVID was already very transmissible. This is twice so, presents particular risk of prolonging the pandemic, which would primarily affect those who have yet to get their shots. Quote, "This is a pandemic of unvaccinated people," LA County Public Health Director Barbara Ferrer said during a briefing Thursday. Of the 123 people confirmed to have been infected with the Delta variant in LA County, 110 were unvaccinated and 3 were partially vaccinated. There were 2 hospitalizations among people in this group. The public health director also said, if you are fully vaccinated, you have a lot of protection. And for the very small numbers of people that may end up, in fact, with a breakthrough vaccination case, they really do not have serious illness. So right there, big headlines, red letters. We should all know the majority of people dying from coronavirus now today, as we move forward in this, mid-vaccination phase where we're getting close to a herd immunity level. The big problem here is, the majority of the fatalities or the mortality rate is unvaccinated people by a astounding degree. And if you are unvaccinated and you still get infected, because we now have much more contagious versions of this virus, these variants. If you do get it and you're vaccinated, you're much more likely to have a less severe illness than if you weren't vaccinated. And now, like I said, the majority of people dying from this virus today who are getting it in the United States, unvaccinated. So we have to, if you know somebody who is vaccine skeptical, try to be compassionate with them, but also talk to them about it, engage them on it, and try to, show them, hey, look at the numbers. This is a massive, unprecedented situation. You kind of have to. I get the being critical of a vaccine and wanting to have that basic critical thinking that kicks in and goes, well, I don't want to do it. It's new. It's scary. I don't trust these institutions, et cetera, et cetera. I had one person tell me, I don't want to get a vaccine because I think it's all about the money. And I said, okay, I get the point. I get the feeling. But that's why I think the vaccine is safe, because it is all about money. That's why we're all getting it for free, is because it's about the money of, hey, go get vaccinated so you can then get back to work. That's the way that I see it. And there's places you could look and kind of track how this is moving forward. There's 178.5 million people have received one or both doses of the vaccine in the U.S. 151.6 million have been fully vaccinated. So there you can see, the full population of the United States versus fully vaccinated, partially vaccinated, 53.6. So we're not going to, Joe Biden had this goal of we're going to make it to 70% by July 4th. Go out and have a hot dog and take your mask off, or, all the things he was saying, all these promises made. Not going to make it. Not going to make it there. But here's a fascinating map. You can see the states that are dark green are above the 56% mark, a shade lighter 52, then 48, 44, less than 44. So take a look at the states. I mean, which ones do you feel comfortable going to right now? For me, it's none of these with that are down in the lowest 44 percentile region, right? So you have a lot of people who are just refusing to take vaccines, and now they're more vulnerable. They are, now they're the most vulnerable people you got out there who, it's very sad that if you're going to die from the coronavirus at this point, it's probably you're unvaccinated. It's not like the vaccine gives you perfect, incredible protection, but it's much, much better. And then it also just prevents the people around you from getting infected because we're all carrying these antibodies.